Hello, and welcome to video 4. Let's look back at the crack cocaine era and how it shaped the laws, policies, and attitudes we still rely on today. It was during the response to the cocaine epidemic in the 1980s and early 1990s that much of America's modern drug policy infrastructure, our policies and programs, were built. The hard lesson on the screen points us to what reforms are needed. Drug policies and programs designed for the crack cocaine era must be overhauled for the opioid crisis we face now. So crack cocaine spread rapidly through urban communities in the 1980s. Violence rose, fear, amplified by heavy news coverage of drug-related crime, dominated public debate. Political leaders were under intense pressure to respond quickly and forcefully. In that environment, federal, state, and local governments turned primarily to aggressive drug enforcement and prosecutions. The violence was real, but the response went far beyond targeting the most dangerous actors. Sentencing was toughened across the board, and a vast new infrastructure of courts, prosecutors, jails, and prisons were built up. The result was mass incarceration that fell disproportionately on minority and impoverished communities, alongside a deeply inadequate emphasis on treatment and alternatives to incarceration for the drug addicted. Over time, there have been important changes, including reduced sentencing and a greater focus on demand reduction and more options for diversion to treatment instead of incarceration. But too much of the infrastructure and approaches developed during the crack era remain in place. Here's why those choices still matter and how they shape the system we have today. In response to the crack cocaine epidemic, Congress strengthened enforcement authorities. It made sense to target major cocaine trafficking organizations, but too often, relatively low-level offenders, many struggling with addiction themselves, were incarcerated for long periods without a meaningful pathway to treatment or recovery. Those who were violent or significant drug dealers deserved to serve time, but many others were locked up for excessively long periods, even when no violence was involved. Success was measured largely in arrests, seizures, and sentences. Low-level drug dealers were easily replaced. Health responses existed, but they were secondary. Treatment capacity was limited. Prevention efforts were often simplistic, and addiction was widely framed as a poor personal choice rather than a serious health condition. These incarceration-heavy policy choices reflected the intense pressure policymakers faced to do something. The need for a response was clear, and fear of cocaine, especially after the 1986 overdose death of college basketball superstar Len Bias, was real enough. But the over-reliance on punishment had severe long-term consequences and failed to prioritize the health and social services that people dependent on crack cocaine needed. Before moving on, I want to be clear about something. I'm not telling this history to blame others from a distance. During the crack cocaine epidemic, I was working on Capitol Hill, and there was a broad consensus across both parties, across both Republicans and Democrats, and including almost the entire Congressional Black Caucus, that long sentences and aggressive enforcement were the right responses at the time. I supported that consensus, and as a junior congressional staffer, helped to put it in place. People were frightened by the violence in open-air drug markets, and many believed harsh penalties would protect vulnerable neighborhoods. In that context, the initial reaction to the crack cocaine epidemic was perhaps understandable, but the deeper failure was our inability to adjust and change course far more quickly. We should have recognized sooner that excessive arrests, prosecutions, and long sentences were doing profound harm. In Chapter 7, I'll talk about what a more targeted, effective approach to drug markets looks like, one that protects communities without repeating the mistakes of the past. It is true that in the opioid crisis era, there has been more empathy and support for treatment compared to what was provided to those in the crack cocaine era. This was in part connected to who was addicted to prescription drugs, middle and working class whites in suburban and rural areas. Still, long prison sentences and severe collateral consequences for those re-entering society after a prison sentence remain a problem. Attitudes were changing, and there has been progress in updating policies and programs. However, there is much more work to be done. That's why I recommend that Congress establish a joint House-Senate committee to modernize American drug laws and expand funding streams to match today's realities. We need a substantially expanded focus on treatment and recovery, stronger integration of public safety and health systems, and more targeted approaches to drug enforcement, both at home and abroad. These changes must be embedded in federal law and supported by sustained funding. When this committee completes its work, the House Narcotics Committee, where I worked as a young staffer, should be reestablished to help monitor implementation of the changes. This will ensure that there are at least a dozen congressional staff members working full-time on the evolving opioid crisis and related drug problems. Today, many staffers and committees focus on portions of the opioid crisis, but almost no one looks at the big picture. This needs to change. In video 5, I turn to a very different and important moment in drug policy, the role of one pharmaceutical company, Purdue Pharma, in launching the opioid crisis. Thank you and see you at the next video.